Imagine waking up to a cluster of health problems that seem to have nothing to do with one another. Your vision has suddenly gone blurry, your menstrual cycle is off schedule, and you're fighting a stubborn urinary tract infection that won't clear up. The logic of modern medicine suggests you should start making phone calls. You figure you need an optometrist to check your eyes and a gynecologist to investigate the infections and irregular periods. However, a diagnostician looking at the broader picture will bypass those specialists. Instead of examining your eyes or your reproductive system, they will ask you to fast overnight for a blood draw. That blood test looks for the single systemic failure driving all three symptoms simultaneously. Millions of people spend years chasing these symptoms with temporary fixes, like antibiotic rounds or new glasses, while their entire circulatory system is quietly drowning in its own unused fuel. To understand why, we have to look at how the body processes energy. Under normal conditions, insulin binds to your cells, signaling them to absorb glucose from the bloodstream to be burned for power. When insulin resistance develops, those cellular receptors stop responding. The cells reject the glucose, and the sugar begins to accumulate and multiply rapidly inside the bloodstream. That sugar-heavy blood circulates everywhere, eventually traveling up into the fine vessels of the eyes, where it alters the physics of how you see. High concentrations of blood sugar create an osmotic effect. The glucose physically draws fluid out of the surrounding tissues and into the lens of the eye, causing the lens capsule to swell and bulge outward. As the lens warps, it loses its ability to focus properly. Light rays enter the eye, but because of the distorted lens, they miss the precise focal point on the retina. The resulting blurriness is the direct physical consequence of fluid pressure warping the lens. While the eyes are swelling, the kidneys attempt to handle the overload by dumping massive amounts of excess sugar directly into the urine. For women, this emergency purge transforms the normally balanced environment of the urinary tract and vagina into a sugar-rich zone. This excess glucose provides the energy needed for naturally occurring bacteria and yeast to multiply. Chronic recurring infections follow, alongside metabolic stress that disrupts the hormones controlling the menstrual cycle. Chronically high insulin levels can also trigger skin cells to reproduce with abnormal speed. This results in acanthosis nigricans, the appearance of thick, velvety, dark patches on the neck or armpits. If these visible changes are ignored, the high sugar blood transitions from causing temporary tissue swelling to permanently shredding the inner lining of the blood vessels. This diagram of the human circulatory system identifies the critical failure points in the vascular network. Over time, high blood sugar destroys these pathways, leading to diabetic retinopathy, kidney failure, strokes, and nerve damage that results in lower limb amputations. Treating the infections or the blurry vision without addressing the underlying blood sugar guarantees the eventual destruction of these major organs. There is a biological buffer zone that exists before this permanent vascular destruction sets in. Clinically, this is prediabetes. Doctors identify it by measuring hemoglobin A1C, looking for a level between 5.7 and 6.4%. Unlike full-blown type 2 diabetes, this phase of the disease is largely reversible. Reversing this trajectory requires lifestyle interventions, losing 5 to 7% of total body weight and engaging in 30 minutes of daily exercise. Combining a modified diet with those exercise metrics reduces the risk of progressing to irreversible type 2 diabetes by 58%. Every blurred image or recurring infection offers a window to reverse the damage before the threshold into permanent vascular destruction is crossed.